Good afternoon, ladies and gentlemen. To all the viewers who are watching this session and listening to the entire program, Elsevier, the world's largest information solutions provider to healthcare professionals, welcomes you all to this first time ever Google Hangout session with our leading author, Dr. Somesh Gupta. Welcome to you all, friends, viewers. We thank our online partner, Infibeam, which has facilitated this entire discussion on Google Hangout. Infibeam is the leading online retail partner of Elsevier, provides a great online shopping experience as well. Infibeam has all the stocks of Elsevier books, and you name it, you get it home delivered. Before we actually begin our Google Hangout session, let me give a brief introduction about Dr. Somesh Gupta. Dr. Somesh has authored the second edition of Sexually Transmitted Infections, second edition by Elsevier. His book is available at a substantial discount of 50% with Infibeam, and this offer is till November 15th. Sir is the Regional Director, Asia Pacific Region of International Union Against Sexually Transmitted Infections. He is the editor of Elsevier Journal on STI. He is the editor-in-chief, Journal of Cutaneous and Aesthetic Surgery, joint editor of Sexual Health, and past president of Association of Cutaneous Surgeons of India. He is also honorary treasurer-elect, Indian Association of Dermatologists, Venereologists, and Nephrologists. He is currently additional professor, Department of Dermatology and Venereology. Welcome, Dr. Somesh, to this great session, where we would be discussing on sexual health. It is important but neglected.
Yeah, thank you, Priya, and good afternoon all. Sexual health, this concept is not new to the field of sexually transmitted infections, and WHO had introduced it long time ago. However, still there is not enough response from government and policymakers to implement the concept of sexual health at the primary healthcare level. Now, sexual health, as the WHO has defined, is a state of physical, emotional, mental, and social well-being in relation to sexuality, and it is not just an absence of disease or infirmity. It is a concept of positive health. The sexual health requires positive and respectful approach to sexuality and sexual relationship without any stigma, without any discrimination or violence. And this is the concept of sexual health which needs to be promoted at the national level, at the international level. Now, we need to understand why sexual health is important. All of you may be knowing that homosexuality is still criminal in many countries. Fortunately, in India, the Supreme Court in 2009 declared homosexuality not a crime anymore in India, provided practiced in private. So this is one step ahead in the field of providing discrimination-free sexual health to all the citizens. Now, I have few questions which we received during the promotion of this video program. And one of it is, how effective are the condoms in preventing STIs and HIV? Now, you know, condoms are very important, particularly when in relation to sexual health. And we have seen some countries, particularly in Southeast Asia, implementing 100% condom promotion program, which was very successful in containing a rapidly expanding HIV epidemic. Definitely in India, the condom use is still at a very low level. So, regardless of sexual risk behavior, those who practice risk behavior, high risk behavior in relation to sexuality, and those who don't practice. There is no difference in condom use in these. So what is in India, what is preventing sexually transmitted infections is largely, in addition to condoms, the safer sexual behavior. Now we need to understand sexual behavior in relation to gender. Now we know that sex is a very basic entity of life for any species. To promote gene transfer to the next generation, to have children, sex is an important aspect of life. However, it has been stigmatized in many countries, which is beyond anybody's understanding. Why we need to have attach stigma to sexual health. Now, there is a basic difference as far as gender is concerned between men and women. And we know that sex is associated with pleasure, and this pleasure is associated with complex neurochemical secretions. Now, this pleasure over the evolution of human species has been attached to sex because of propagation of genes from one generation to another. Now, a woman is always sure that her progeny carry her genes, but a man is never sure whether the progeny of a woman carrying his genes or not. So men have a tendency to have multiple sex partners in comparison to women. Now with the social evolution and with the evolution of marriage system, now men are also reasonably sure of having their genetic component in the progeny of a woman. However, behavior has not changed. Still, men tend to have a large number of sex partners, irresponsible and unsafe sexual behavior, particularly in countries like India, where sex is still considered as a conservative aspect of social life. So in relation to that, we need to understand the sexual health. And this needs to be promoted at every level of healthcare system, be it the primary healthcare system, secondary healthcare system, or tertiary healthcare system. Over to you, Priya, again.
Thank you so much, sir. You
Yeah,
have
Priya, you have,
elaborated
yeah.
at length. You have elaborated at length the complications and the concepts of sexual health. We would like to know, because most of the viewers were keen to understand, what are the common sexually transmitted infections, and are they still a significant public health problem?
Yeah, Priya. Sexually transmitted infections are a hidden epidemic, and hidden because uh, it is associated with sex, and many a times people do not come out with their problems, or they carry asymptomatic infection for a prolonged duration and keep on transmitting the infection. The WHO data suggests that 500 million people every year acquire curable sexually transmitted infections which have a definitive cure available. So among these, one of the commonest sexually transmitted infection is chlamydia. Apart from that, gonococcal infections and syphilis, herpes simplex virus, and genital human papilloma virus. Now, these are the common sexually transmitted infections, but there has been a resurgence of some uncommon sexually transmitted infections in recent times, and one of this is LGV. Now, many of these organisms are changing their behavior. Earlier, they had florid manifestations, but in recent times, these organisms are having more subtle and asymptomatic infection in comparison to the past. So these infections are more often hidden, and then they often cause complications. They are hidden and they are asymptomatic, but this doesn't prevent the complications. And these complications include genital cancers, genital cancers, lower abdominal pain, complications in pregnancy like infertility and stillbirth, and so on. So these are the complications, and we see these complications in the society at a quite high prevalence. So this means that these infections are present everywhere, but they are not often detected. That's why we need to have a screening program, a proactive approach It is not just a patient coming to the hospital and treating that patient will not going to work. We need to screen the patients, and the screening program is largely inadequate or absent in countries like India, South Asia, other South Asian countries, or Thailand and Southeast Asian countries. Some of these countries have good screening program, but not adequate and not reaching to all population levels. Yeah, Priya.
Okay, sir. Sir, one of the viewers also wanted to know how does STI and HIV interact? He wanted to have an idea on that.
Yeah, sure. I also have one question in my hand, and that one viewer asked whether non-ulcerative STI are also associated with HIV transmission, and if so, how and why? Now, we largely divide sexually transmitted infections between ulcerative STIs and non-ulcerative STIs. Now, HIV has its target cells, the cells which are infected at the initial level by the virus. And these cells are CD4 T lymphocytes, as well as Langerhans cells and dendritic cells. Now, these cells are recruited in large number when a person has genital ulcers present. Now, if a person has genital ulcer and is exposed to a person who has HIV, now there are two issues here. One is that the epithelial barrier is lost, epithelial barrier which prevents entry of the HIV to the body, that is lost. So there is easy access to HIV, access of HIV to the target cells. Now these target cells are in plenty in the infiltrate on the genital ulcer, as well as in other non-ulcerative inflammatory genital sexually transmitted infections such as urethritis. Now, if a person has both genital ulcer and HIV, now such a person is more potential like transmitter of HIV, because these CD4 cells, T lymphocytes, they are full of virions, HIV virions, and there are a large number of studies which have shown that the viral when in an HIV positive patients, if a patient has genital discharge or a genital ulcerative disease, the secretions carry a large number of virion in comparison to those who do not have sexually transmitted infections. So here it is important to target sexually transmitted infections and prevent sexually transmitted infections, and this in all probability will have an impact on HIV epidemic. So that's why the sexually transmitted infections are important. They need to be managed quickly, they need to be treated quickly, proactively, by screening, and this will also give us opportunity to reduce the HIV transmission. Over to you, Priya.
Yes, sir. So, AIDS and HIV related problems are the modern day diseases, and doctors and the medical field around have accepted this as the biggest challenge to humanity. Do you see a lot of trend in terms of medical education, students opting for this subject? Do you see any
Yeah.
change in terms of selection? What do you have to say
Yeah.
about that?
No, you see, HIV is a disease which manifests in almost all the organs of the body. It is an essential part of medical education, and it is an essential part of any specialty you choose, whether it is neurology, whether it is cardiology, whether it is internal medicine, dermatology, any disease you name it, any specialty you name it, and you have to deal with HIV manifestations. So HIV is not a one particular branch. It is a disease with a spectrum of involvement of all the body system organisms. Once this kind of scenario was true for syphilis, when syphilis was rampant, endemic, and there was no treatment available. There was a saying at the time that you know syphilis with all its manifestations and you learn all aspects of medicine. Now the same quotation fits well for HIV. So HIV is an essential part of medical education, whether it is undergraduate teaching program or whether it is postgraduate teaching program. Yeah, over to you, Priya.
So there are certain curiosities in the general society, the civil society, and NGO especially regarding government interventions, government policies uh, in terms of such STIs, controlling of STIs, AIDS control. So can you throw some light on students or medical people on what is happening in South Asia regarding this?
Oh yes. India's and there are two examples. One is India's and one is Thailand's. And these two countries have managed to contain HIV epidemic significantly. And now we have one of the lowest prevalence countries in South and Southeast Asia. And the credit goes to awareness program, particularly by agencies like National AIDS Control Organization and Government of India, promoting and creating awareness about the HIV, providing safe sex means such as condom use and education program. So this led to now it is not just stabilized; it is going down. The plateau phase is over, and now the HIV prevalence is going down. Another very important aspect in this is treatment program. Whenever a person with HIV is treated, it also helps in the prevention because the HIV viral load goes down with any kind of antiretroviral therapy or anti-HIV therapy. And with lowered viral load, the transmission risk also goes down to the partners of the person who has HIV infection. So treatment for prevention is a new focus area, and the WHO and National AIDS Control Organization of India, they have covered, they have started the treatment centers for HIV in a large part of the country, and this has led to probably a decline in the HIV prevalence in India. And some of the states of the country, India, are glaring example of such a successful containment of this epidemic. And one I would like to mention here is Tamil Nadu. They have done fantastically well. One of the earliest HIV cases were reported from uh, Tamil Nadu, being a coastal area, and subsequently there was a rapid increase in the HIV epidemic, but fortunately now the HIV has come down significantly. So government has done well, National AIDS Control Organization has done well, and in addition, several non-governmental organizations have done very well in this field. Like Gates Foundation has supported a large number of focused HIV intervention program, particularly in sex workers and migrant laborers and transporters and truck drivers who carry the infection from one part of the country to another part of the country. So the response has been fantastic, but I'm hoping that this response is maintained and there is no fatigue in this particular field, so that the HIV intervention program continues with full strength. Over to you.
Thank you, sir. So, we were also asked by many viewers as to how to approach the subject of STI, and also since you are heading the Department of Dermatology, we would like you to elaborate on how a new student who's just in medical undergrad comes and approaches this subject.
Right. So this subject basically starts from the microbiology when we start understanding about the pathogens which cause sexually transmitted infections, and some of them are taught in details such as Treponema pallidum, which causes syphilis, chlamydia trachomatis, which is an organism which causes trachoma as well as genital and urethral infections, sexually transmitted infections, Neisseria gonorrhoeae, which is also responsible for an important sexually transmitted infections, gonococcus. And then we read about these infections in pharmacology, where the treatment of these diseases is given in the syllabus, in the course. And then finally we study this in the in the final professional exam during the final prof of undergraduate students, MBBS students, where they study about the clinical aspect of these diseases. So it is important to read these diseases. Without studying HIV and other sexually transmitted infections, nobody can become a good physician in present era, because they are, although the focus is lost in the past few years, but they are still very, very important. And I must tell you that they are among top 10, sexually transmitted infections are among top 10 causes of infectious diseases for which patients present to the physicians. So these are very, very important, and they need to be students need to understand the importance of these diseases. Over to you, Priya.
Yes, sir. So there, the book that we have the honor of being published with you and the other contributors, which is a sexually transmitted infections, second edition by Elsevier. So can you tell how this book is so unique? We can see it's a big book. You're also having a sample
Oh,
copy. It would
yes.
be wonderful if you can show this to our viewers. And so we
Oh,
would like you to tell us about the contributors across the globe. It's an
oh,
international
yes.
global book with beautiful content.
Mhm.
So
Yes, right, Priya. Now this is a book. I don't take the credit of everything in this book, because you know this book is important because this book has many contributors from all four continents of the world, and probably this is the only book which has contributors from so many countries in this field. So it, the challenges in sexually transmitted infections vary from region to region, country to country, but still the basic challenges remain the same. So this book tries to address all the issues, not just in developing countries, but also the developed countries. Now, many renowned people who have edited various sections of this book, many from WHO, like Antonio Gerbes and Basil Donovan from Australia, Brian Mulhall from Australia, Charlotte Geddos, she's from Johns Hopkins University in USA, Christopher Fairley from Australia, Darren Russell from Australia, Graham Nielsen, he's from Thailand, and Dr. Manyar, he's from Mumbai and renowned HIV expert, Jonathan Ross from England, and Mikhail Gomberg from Russia, and Patricia Garcia from Peru, that is in Latin America, and Raj Patel from UK. So you see that all many renowned people who are working in this particular field from all the continents of the world, they have contributed to this. People from Africa have contributed, Latin America have contributed, North America, Europe, and Asia Pacific region. Now there is no hardly any other book except one from the father of STI medicine, Professor King K. Holmes. That is the only book of this kind available across the globe. So this book is truly international, published from India. That's an honor for us, and that we have so many people from so many organizations like Family Health International, people from Family Health International, people from World Bank, WHO, World Health Organization, CDC, US, and so many people have contributed, generously contributed to this book, and that's why this is indeed, you have declared it as one of the best sellers for Elsevier. And this is available, and as you announced that Infibeam is providing 50% discount till 15th of November. That's a very good promotion scheme, and I hope this will work. More people will purchase this book. More people will have better focus on sexually transmitted infections. Thank you, Priya. Over to you.
yes, sir. So the last, we were just about to conclude the session. It has been wonderful time discussing all the salient features related to STI, to AIDS, to HIV. So the viewers are keen to know just some few tips how to make a career out in this field, firstly, and some personal guidance that you would like to give to our viewers.
Yeah, you see, this sexually transmitted infection, this book is not just for students. It is for various people working in NGOs. It carries, it also provides guidelines, syndromic management guidelines. So a person working at the primary healthcare level will also find it useful. All the students who are pursuing in sexually transmitted infections, general medicine, internal medicine, or HIV medicine, they will find this book very, very useful. Those who are working in public health or community medicine, they will find a large section of the book handling this community medicine aspect of sexually transmitted infections. So this book is useful, this title is useful, but that's important. But more important is that the government should bring back focus on sexually transmitted infections. They should not lose the focus on HIV. There should be no complacence. So we have seen epidemics going and coming back again if neglected. We have seen syphilis epidemic in China in recent times. So these diseases cannot be left alone. They have to be handled and constantly handled. Whether this book, they buy this book or they don't buy this book, but STI as a subject should remain in focus for the benefit of people.
Thank you so much, sir. That is the Elsevier spirit. We believe in delivering content in a way that most of the readers can acquire it. That's why we have partnered with online retail partners like Infibeam. And this entire Google Hangout session, I think, is fantastic. Those viewers who have just joined in, you can find the video stream after we have just concluded. It would be recorded, and you can simply Google in and YouTube and have a look at it. You can also visit our Elsevier India Facebook chapter. There the link is visible at YouTube and the video is permanently stationed for you. The offer of 50% discount still holds true till November 15th at Infibeam. So please make full use of it. Thank you so much, sir, for your valuable time and spending these moments with you. Thank you so much, sir.
Thank you, Priya.
Thanks, sir.
उधर से होगा एंड ब्रॉडकास्ट उधर से होगा